Do I have a conversation for you? If you've always heard that gluten is not ideal for you, or grains are not ideal, and you don't know a ton about the nuances other than that there are anti-nutrients and they might poke a little bit of holes in your gut, I highly recommend watching this interview. I also get to share a lot more about mold illness and how it affected a doctor and how he started a mission to support people that have mold illness and how we ended up serving the mold illness and chronically ill communities. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition. And I have a private practice where we have served over 2,000 carnivore clients and patients get closer to root cause healing. And that often starts with the Carnivore Cures all meat elimination diet. Today, I had the pleasure of sitting down with Dr. Peter Osborne. He is one of the founders of the grain-free diet, gluten-free diets. You will learn a lot more about why it is so harmful for gut health, why it is one of the biggest triggers of autoimmune illness, and how he talks about the 4 factors that cause autoimmune, how mold plays a big role in it, and his own journey in mold illness. This conversation gets into a lot of detail, nuance, but it will help you to understand where your autoimmune may be coming from, what culprits can be causing autoimmune, and how you can support your body to better heal. I hope you enjoyed the conversation as much as I did. Let's get right into the interview. Hi, Dr. Osborne. I am super excited to have you on my channel. I know we've talked a lot about mold illness, gluten-free stuff, and lots more stuff about wellness behind closed doors, but I'd love to have you talk to our community. For the people that may not have heard of you, if you can introduce yourself.
Absolutely. I'm Dr. Peter Osborne, trained originally in chiropractic, but I'm also board certified in clinical nutrition, a doctor of pastoral science. And I've been in practice for 23 years. I'm the vice president for the American Clinical Board of Nutrition, and I'm on the board of advisors for Functional Medicine University. I've been a college adjunct professor of neuroanatomy and biology and physiology. And mainly, I just love doing clinical practice. And on top of that, I love educating folks. So we have an educational platform where we just try to teach people about how to empower themselves to take control of their own health.
Yeah, I watched several of your videos, and they're shorter clips where you can really understand about a certain topic, a certain supplement, a certain illness. And I think it's very helpful. I'll put that all in the show notes. I wanted to go back in time and talk a little bit about how did you find your way into the whole gluten-free world? And then I also want to talk to you about how you found yourself in the mold space.
Yeah, so it's an interesting story. When I was going through graduate school, I interned in the VA hospital in rheumatology.
Mm-hmm.
And so my time there as a veteran, because I'm a veteran, and so I have a passion for other veterans and trying to help them. But these people were coming in, they'd had rheumatoid arthritis, lupus, scleroderma, psoriatic arthritis, ankylosing spondylitis, you name it, the whole gambit of autoimmune arthritides. And what really frustrated me about being an intern in the hospital was there was never a mention of diet or nutrition or lifestyle. Everybody got pretty much the same thing. Methotrexate, which is a cancer drug that's used for pain in autoimmune disease, or hydroxychloroquine, which everybody knows what that is now after COVID. But then it was hydroxychloroquine, also known as Plaquenil, which is it's a drug that helps with pain. Those are called disease-modifying anti-rheumatic drugs. Or they got gold injections sometimes. They don't do gold injections, not so much anymore. This is 23 plus years ago, but no diet change and no lifestyle. And so on the first week of that rotation that I was doing, that internship, I was handed a book called The Primer on Rheumatological Disease. And so my attending physician said, here's the book. And all the other attendings that were there, they were given the same book. Said, go home, read it over the weekend, and if you don't read it, don't come back. So I went home and I read the book, and it's a thick book. We're not talking about a pamphlet. We're talking about a pretty thick medical text. And anyway, it was very enlightening. It was a great book. I'm glad that they gave that to me and asked me to read that, and I did. And so the first week coming back from reading the book, as a student, I was just observing what the doctors were doing, how they were engaging with patients. And after a week, I realized the pattern, which is all they got was drugs. And on Wednesday, if the drugs weren't working, the surgeons came in and did a surgical consult, and then that they were doing surgical replacement surgeries. You know, you need a new knee, you need a new hip, or whatever it was. And I'm like, okay, now I'm curious because you gave me this book and you asked me to read it, and I spent the entire weekend reading a book away from my family, which I value, and I'm paying to be here because I'm a student and I'm paying the tuition. Why aren't you doing what's in the book? That was one of my first questions, and I was immediately frowned upon, as you can imagine. But I was just curious. I wasn't trying to be disrespectful, but what the book taught me was that there were triggers for autoimmune disease, definite triggers that were researched, that were well documented, that other rheumatological PhD peers were writing about, because this book was written by a conglomeration of 100 plus doctors, and so I was kind of told to be quiet, and I said, no, I'm not going to be quiet. I'd like to know why, if we know pesticides can trigger myasthenia gravis, when a myasthenia patient comes in, why are we not checking them for pesticide? If we know that gluten has genetic similarities with rheumatoid arthritis, and that many people with gluten sensitivity can develop rheumatoid arthritis at greater risks, and when they go gluten-free, their pain goes away, why aren't we checking patients for reactions to gluten? If we know that vitamin D deficiency is a trigger for autoimmune disease, why aren't we measuring vitamin D? Like, I don't understand. I just really want to know. No disrespect, but I was told to be quiet again, and kind of dismissed and ignored. And so then I would come back each week, and I would bring stacks of medical literature, because this is, again, this is the VA hospital, and just right across the way is the Jesse Jones Library, one of the world's largest medical libraries. And this is, Judy, this is before you could just get online and tap into 20,000 journals, right? This was like microfiche, go to the library, card catalog, that kind of stuff, and pull off dusty books off the top of the shelf you climb a ladder to get to. And so I would copy all these research studies, and I'd bring them in, and I'd be like, look, gluten sensitivity and rheumatoid arthritis, look at all the connections. Look how many people we could help. Give me 10 patients. I'll take them aside. We'll do gluten-free. We can even publish it, and we just see what the outcome is. You can still medicate them. You can still treat them. I'm not saying don't do what you do. I'm just saying let's do this too. No, the stack of literature I handed to the attending was thrown in the garbage.
Wow.
So I went back and I started collecting data on fasting, because I thought, okay, food, okay, doctors aren't trained in nutrition, I get it, but what about fasting? Maybe we can approach this from a different angle. And I brought in stacks of studies on when you fasted a patient with rheumatological arthritis, within 48 hours, the pain was either dramatically lower or gone. I'm like, come on. It's in the diet, right? It's not rocket science. If you can fast them, that means they're not eating. That means something they're eating is potentially the trigger. I was dismissed again. So I went back to the library and started collecting data on omega-3, because there was a growing body of robust literature on omega-3 as an anti-inflammatory at higher doses. And so there were even some studies comparing non-steroidal anti-inflammatories to omega-3 drugs, showing omega-3 had superior outcomes without the side effects, right? Because non-steroidals like ibuprofen and some of the other, classics, they rip holes in the gut lining, right? They erode the mucosal layer, cause vitamin C and iron deficiencies, and they're just not good long term. But here we have fish oil, 4 grams a day, 6 grams a day, boom. We could get some pain relief. And prescription oil at the time was actually making its way onto the pharmaceutical scene, because it was being manufactured as a type of prescription to lower cholesterol. So there were new fish oil drugs that were being prescribed. So I thought this is maybe more in the wheelhouse of the doctors who are medicine oriented. But again, I was dismissed. And so it was super frustrating for me. And I left the hospital setting, and shortly after, started my own private practice. Well, I always look back at that setting with fondness, because they taught me a lot, even though they didn't want to apply what they taught me. But my first, not my first, one of my first private practice patients was a 9-year-old girl. She had been diagnosed with juvenile rheumatoid arthritis at the age of 2.
Wow.
And so she didn't ever crawl like a normal kid. She never really fully developed like normal kids do, because she was in so much pain. She had a stent, or not a stent, but a port embedded in her arm, because she was in and out of the hospital so frequently for pain medication management. And so for 7 years, from the age of 2 to the age of 9, this little girl was treated with methotrexate, and with pain medications in and out of the hospital. And one day the doctor looks at her mother, and her name is Ginger, and he says, your daughter Ginger, there's not much more we can do for her. She's going to die. She's got 6 months to live. You need to go home and get your affairs in order, is basically what he told her. And so she was driving home just crying. You could imagine, being a parent, could you imagine getting that news? And she drives by my office, and I think it was a God moment, right? Because she's crying and she's driving by my office, and she just stops and pulls in, and she talks to my staff, and they end up setting up her daughter an appointment. And so we see her, and she's gluten sensitive. I tested her for gluten sensitivity, and that she was positive. She was also positive for a blueberry sensitivity, which is interesting because every morning her mom was trying to help her by feeding her a blueberry smoothie, because blueberries are an anti-inflammatory superfood, right? So here we have a child that's, inundated with gluten and blueberries, and those are the reactions that she has, kind of the biggest inflammatory responses to. So we change her diet, and within 6 months, the port comes out of her arm. She's not dead. And within 12 months, she's off methotrexate in total remission, no signs of inflammation.
Wow.
And then, fast forward 20 years later, she graduates college and she's out in the world doing things wonderfully. And that was my first endeavor into the world of autoimmunity and gluten sensitivity as a trained chiropractor. A lot of people say, well, you're a chiropractor. How are you treating, autoimmune arthritis? Well, it's because that was part of my training, and that's where God steered me. So ever since Ginger, I realized, because if you do the math on autoimmunity, there's, in the US alone, there's 46 million cases, right, of autoimmune disease. And if you look at autoimmunity as a whole, doctors, because of specialization, have tried to say, well, there's this autoimmune disease and this autoimmune disease, over 100 different kinds, right? But they're all the same thing. At the end of the day, all autoimmune disease is the same underlying process. It's an inflammatory process that affects the immune system and causes the immune system to appropriately react to an inappropriate environment for the person who's living. And so the outcome of that could be rheumatoid arthritis if it affects the joints. It could be psoriasis if it affects the skin. It could be autoimmune hepatitis if it affects the liver. It could be any variety of autoimmune conditions. Everyone's different, unique in their manifestation. But if you look at the core underlying theme of why autoimmune disease occurs, there's 4 categorical things: food, chemical exposure, microbial imbalances, and nutritional deficit. Very simply put. I mean, there's more nuance to that, but if I'm really trying to simplify it, it's those 4 categories are the primary driving forces behind why autoimmune disease occurs. And it was Ginger who taught me that, and the VA hospital that taught me that. And here I am today. And that's why I have an online platform. That's why I've written books. That's why I do research, because 46 million people are in dire straits. 1 in 7 Americans, and probably more than that, because many diseases that we don't classify as autoimmune actually are autoimmune. There's an autoimmune component to osteoporosis. There's an autoimmune component to heart disease that people just aren't aware of and aren't well studied over, including doctors. But at the end of the day, it's the #1 cause of death in women under the age of 65. So it is very, very fatal. It can kill you. It is no joke. And there is no hope if you go mainstream. The only hope in mainstream is that you can manage to get symptoms under control, which is fine. I think people deserve a quality of life.
Right.
But when doctors seek to suppress symptoms but don't seek to understand why the disease exists and help the patient become empowered to not need the medicine for the rest of their life, I think what you end up with is a lot of long-term side effects of medications that are also potentially life-threatening. I mean, we know that non-steroidal anti-inflammatories can cause perforation of the intestine, occult blood loss, vitamin and mineral deficiencies. We know that drugs like methotrexate can also rip a hole in the intestinal lining and increase the aging process, suppress folate and lead to DNA mutations and increase the risk for certain kinds of cancers. And now there's a whole new class of drugs called biologics.
Right.
in biologics, if you look at those, they have the strongest black box warning on them of any other kind of drug that for cancer. They cause cancer. So you're trading autoimmune disease for cancer when you stay on these drugs indefinitely without seeking, diet and lifestyle accommodations for better outcomes.
And I think a lot of these medications don't work long term because we'll always hear people say, "Oh, I'm on this medication, it helped for a little bit and now it's not helping enough." I have so many questions with what you just shared. I loved everything you just shared. Let me first ask about the four. So, your four main culprits of autoimmune. So, you think those four main things, and maybe if you can give a few examples of the four of how they then exacerbate autoimmune.
Okay, I'll start with the most well-studied cause of autoimmune disease and the most well scientifically agreed upon, and that's gluten. Gluten induces an antibody response. And if we're talking about celiac disease, it causes an immune response where people start to produce a chemical reaction, antibody reaction that attacks their own intestine and causes a flattening of the folds of the intestine, the villi. And then when you have villus atrophy, that causes severe malabsorption and malnutrition, and then you suffer the consequences of malnutrition, right? So every sequelae there that comes after malabsorption is malnutrition. And so, for example, it's very common for people with celiac to have zinc deficiency. Zinc deficiency can cause acid reflux. It can cause muscle aches and muscle pains. Zinc deficiency is linked to immunosuppression. Zinc deficiency is a cause of insulin resistance, right? So we have all those consequences down just from one mineral, right? I mean, we've got 40 essential nutrients, but we could talk for hours and hours and write libraries and chapters of books on just the nutritional consequences of the autoimmune inflammation of celiac disease. But it's even beyond that, because we've also recognized that eating gluten and other foods, right, that stimulate autoimmunity will spark immunological antibody, not just antibody, but antibodies the most well studied, antibody responses that end up attacking tissues of the body. So we've now identified antibodies that can attack the brain. There's a group of Oxford researchers out in the UK, Dr. Marios Hadjivassiliou and his group. They believe that gluten can just affect nerves, like only nerves. It doesn't have to affect the gut at all. It just causes antibody reactions against the brain, causing deterioration of the cerebellum, leading to cerebellar ataxia, and other neurological manifestations. So again, I'm going deep. So let's simplify. You can spark an autoimmune antibody response that leads to tissue inflammation and tissue damage. That's food. Okay, so that if we look at the category of food, gluten's the most well studied, but any food can do it, and it depends on the individual. As the adage goes, one man's food is another man's poison. The second category is chemical exposure. We're exposed to arguably 60,000 chemicals in both in the environment and in our food today, none of which have been adequately studied for safety. Most of them in our food have been grandfathered in as safe, but not adequately studied. There's a whole science called the GRAS list, the generally recognized as safe food additive list. It's been around for decades, and but none of it's been really well studied, and the industry influences it so heavily that we can't get honesty in what is and what isn't safe. But many of these chemicals I find, and we test for this, we find people reacting to these chemicals as a trigger for their autoimmune response. So this could be chemicals like food dyes, food additives, preservatives, chemicals in your soaps, your lotions, your shampoos, your household cleaning items. It could be chemicals like petro-based chemicals that you might breathe in the air from gasoline, from gasoline and petrochemical runoff, etc. So there's a lot of different things in that category. Toxic heavy metals are an example of chemicals. On the topic of mold, mycotoxins are examples of chemicals secreted by mold. So those are things that all we know can trigger an autoimmune response through inflammatory cascades and pathways. And then you have a third category, which is microbes. There are different types of microorganisms: mold, bacteria, or parasitic. You also have yeast, which is a little different than mold. For your viewers, I know you know the difference, but yeast is a single cellular microorganism that can live in you, like candida. And mold is a multicellular microorganism that typically grows on things outside of you. So things that decay wood and that decay debris in nature, right? Mold is nature's great recycler. So everything is returned to ashes. dust to dust, ashes to ashes, right? By mold. Mold is what I believe God created to make sure that everything comes back to the dirt eventually. So, but you can have mold in your home. You could have mold in your environment. You could have yeast as a mold growing inside of you. These are microbes. And so they make different toxins and different chemicals that can stimulate immune responses in a variety of ways. There's not just one pathway. There are multiple pathways that can occur. As an example, yeast produces a toxin called hyphal wall protein that looks like gluten. It has molecular homology with gluten. So if you're gluten sensitive and you have a candida overgrowth, you actually have a little tiny gluten producing factory living inside of you. So your diet could be perfect, but you're still being exposed to enough gluten to induce a persistent inflammatory problem. That's just, one example. You also have little chemicals called lipopolysaccharides that are produced by bacteria that the research is becoming very evidently clear that these are called endotoxins, that these toxins produced by the microorganisms that live in your gut can rip holes in your gut lining and cause fatty liver disease, and then go systemic and cause systemic inflammation, leading to or contributing to autoimmunity. So, and so it's not that microbes are bad or evil. Like in this category of microbes, it's about imbalance. Notice I didn't use the word infection, and I didn't just blame microbes, because there's a milieu of microbes within our gut that on the order of magnitude 10 times greater than the quantity of cells we have in our human body. They're very important. These microbes also help us produce vitamins and digest our food. These microbes talk to our immune system about appropriate behavior. Like it's like a telephone line between the immune system in your gut and the bacteria. They talk back and forth, and they have strategy. They plan. That's called immune crosstalk, and that's been really well established and studied. And so it's not that all microbes are bad, but it goes back to, if we have an imbalance, if we have too many of one species, now the chemicals from that species can start to create a bigger problem. Does that make sense? So it's imbalances that occur, and imbalances aren't the same thing as infection, because infection is typically an acute scenario where you run a fever and maybe you have some sepsis and you need to be in the hospital and get some antibiotics or something. This is more of a kind of a chronic presence of an overgrowth of certain ones that your body is just chronically battling but not winning. And so it creates a milieu of inflammation. And then you have a fourth category, and that's nutritional deficiency. And probably the most well-studied nutrient as it relates to autoimmune disease, nutrient deficiency, is vitamin D. And we know there's a direct relationship between vitamin D deficiency and rheumatoid arthritis. Direct. It's super obvious as a connection. We also know that vitamin D deficiency can contribute to type 1 diabetes as well. So zinc deficiency is another really common one with autoimmunity, because zinc and vitamin D both help regulate the maturation of white blood cells. So I like to use the story of Goldilocks and the Three Bears. If you are familiar, the porridge, right? It's either too hot, too cold, or just right. Well, the immune cells, when they're being born and they're maturing, the thymus gland helps this process under the direction of vitamin D and under the direction of zinc. And so if you don't have adequate quantities of these nutrients, your immune cells are being released. They're too strong. See, with vitamin D and zinc, the immune cells that are too strong are being naturally selected to be killed, right, through apoptosis. The ones that are too weak are being naturally selected to be killed, but the ones that are just right are the ones that are being released into the main circulation. And so if you have too strong of an immune cell, you're predisposed to autoimmunity. If you have too weak of immune cells, you're predisposed to infection and cancers. So we need those vitamins to help regulate immune function and immune reactions, and certain deficiencies definitely link to the development of autoimmunity. So again, those four categories, those are just some examples for you. Anyway, we could talk all day about the nuance, but I'll stop there.
Yeah, I loved a lot of what you shared. So, if I were to give a mold patient as an example, we see a lot of those deficiencies. So, it's always interesting to figure out, we see tendencies because we see a lot of blood work and functional tests. And then you just wonder, is it really the vitamin D that's low, or is it because this person is suffering from mold illness that's suppressing the vitamin D? And we've seen people that as they heal through their mold illness protocols or get out of mold in general, then their vitamin D will naturally kind of go up on their own. So I see all these interesting factors. Absolutely, zinc is important. Zinc also helps you to produce more hydrochloric acid, which is your stomach acid, which will even support your gut function. But we also see this correlation too of autoimmune. So it is not totally every autoimmune patient we have has mold illness, but we also see this correlation with, we get a lot of people with Hashimoto's or other types of autoimmune. I think Hashimoto's is one of the bigger ones, and RA too. And then over time, we often find that there's some exposure to mold illness. And so I don't know what your experience has been, but is there a, of the four, is it a blend of all of it? Is it just like one is, one causes more susceptibility? So is it that certain people have more susceptibility to the mold illness, to autoimmune? What are your thoughts? Or is it just that everyone is nutritionally deficient because we're spraying all these chemical toxins and ingesting them and using them and not knowing? Hey guys, just a really quick interruption. If you notice, we don't really run ads on this YouTube channel. And just being fully candid, instead of making money on external sponsors, we really wanted to share more about our functional medicine practice so that if you ever need it, you know that what we offer and what we can provide in terms of service and products. If you didn't know, our private practice has one-on-one sessions. We have packages. We do group calls with CIRS and with mind body or nervous system regulation. And we also do a lot of functional tests. Some people do a complete wellness panel with us. So once a year, they get a detailed, comprehensive blood work to see how their health is doing. We also do functional tests such as stool tests to see if you have parasites or candida or H. pylori. We also do a lot of the Dutch urine as well as saliva tests to make sure that your hormones and thyroid is functioning well. Our flagship is our symptom burden, where we really trust the innate wisdom in our bodies. And so we are trying to see, what symptoms do you have? Because oftentimes a combination of symptoms is related to a specific system. We focus on gut health, where we try to get people's gut healing, because most of our immune system is in our gut. If you make your own body stronger, you will be a lot more resilient to everything that is in our toxic world. We believe in wellness for all, and not everyone can afford to work with us. So we provide a lot of free guides, free ebooks, free downloads, free tactical things to get you healing in your wellness journey. We also write comprehensive, detailed articles. For example, why a carnivore diet may have lower T3 markers, but may be in fact okay. I hope that the content I share is enough for you to get healing. But if the needle is not moving enough with a carnivore diet, with lifestyle changes, with mind body work, if it's not moving enough when you are working alone, just know that we have the services to support you when and if that day comes. Because we are holistic health, we also have a prescriber. So if you are on thyroid medications or hormone medications, or you need medications for CIRS, we are able to walk you through the process. Our goal is to get you off most of your medications. All right, guys, thank you for being part of this community. Let's get back into the video.
It's a great question, and we'll never have an answer to it.
Yeah.
Because every case is of its own merit, of its own
Totally.
uniqueness, right? You've got genetic predisposition factors, but you've also got factors that a person isn't even controlling, like what did their mom get exposed to when they were in the womb from a chemical perspective, or what kind of stress they were dealing with at home growing up. It's always a milieu of soup of reactions, and this is why it'll never be. Nobody's ever going to develop a magic pill, cure, a potion, or elixir for autoimmunity, because it's unique for different people. And in my experience, and I don't have all the answers, and I don't think anyone does, but just my experience, and I've seen more than 10,000 cases of autoimmunity go into remission in my career. There's never a one size fits all. That's why we test. We test because what we're trying to really do is identify what are the unique 3 dozen triggers for this person, that if we could empower them to make those changes in their diet or lifestyle, would calm their immune system down enough to empower them to know that all the aches and the pains of diet change and lifestyle change are worth continuing on for, right? Because if you change somebody's diet and lifestyle and they have no benefit and don't feel better, how long do you think they're going to keep doing that, right? Because society's hard enough, because society, as you know, promotes horrible behaviors as normal.
Yes.
So we have a lot of people that come to see us that are like, what do you mean you want me to take that out of my diet? That's all I've ever eaten, right? And anyway, my point being, I think it's not one thing. I don't think we'll ever find one set of criteria. That's why I've tried to categorize it as simplistically as I can into 4 categories of families of triggers, so that people have a better understanding when we're running lab, why we're running those labs. Like, what does my gut microbiome have to do with autoimmune disease? As a lay person, I can't make that connection. Help that make sense to me, doctor. And so that's what we try to do. And then once we have, a unique blueprint back for that individual, we put it in place, and then we have monitoring where we monitor two things, right? One, we monitor their subjective improvements or lack thereof. And so if they're getting better, we're winning. And the other, we monitor any kind of objective findings that need to be monitored. For example, if we're talking about somebody with chronic inflammatory arthritis and their CRP is elevated and it's 50, I want to know in 3 months, is it 25, right? Is it coming down? Is it normalizing? Do we see the trend going back to normal? And if we're seeing those kinds of trends, we know we're on the right track. And if we're not, we know we're missing something, and we can dig deeper for other potential reasons as to why autoimmune disease might be caused that are more esoteric. So those 4 categories are what I call the non-esoteric things. But then there are more esoteric things that could also contribute that are more rare, less common, that if you're going to do a deeper dive, it just costs a lot of money. And so it doesn't serve people to just spend tens of thousands of dollars on rare tests to go looking for something when nobody's ever even asked the 4 categorical fundamental questions of what's triggering their problem.
No, I love it. We end up seeing a lot of metabolically unwell people. So maybe they have diabetes type 2, insulin resistance. So then they try to eat like the keto-fied versions of bread, but it still contains gluten. But hey, the carb count is low. And in our practice, we don't, because we love focusing on gut health as a fundamental because most of our immune cells are there. What are your thoughts? So should everyone remove gluten from their diet, even if it's a low carb or low keto-fied version?
I mean, I have a pretty strong opinion. I've built an entire career out of saving lives with a gluten-free diet. And I mean, when I say gluten-free, Judy, I don't mean the traditional sense of gluten-free wheat, barley, and rye only.
Okay.
I'm talking grain-free.
Okay.
Because when I wrote No Grain, No Pain, and this was a culmination of 20 years of research and work in the clinic, we found early on that when we took people traditionally gluten-free, wheat, barley, and rye-free, they would get better in the first few months. And then they would discover the products, the keto breads, the corn fiber keto snack BS that's not good for you anyway, but the rice crackers and all the other grain-based, supposedly gluten-free things. And then what we would see is we would see them start to go backwards.
Mm.
I actually term this gluten-free whiplash, because they go gluten-free in the traditional sense, and then they start discovering, the products, and then they get better, but then they start going backwards. And so I started doing more research at the time. This has been 20 years ago. And I came across originally some really wonderful research by South American doctors, because one of the primary staples in South America is corn.
Mm.
And what they were doing is they were seeing the same kinds of problems, is that people with gluten-free diets were not getting better. And there's some research showing that 92% of celiacs have persistent villus atrophy on a traditional gluten-free diet. And these are 5-year studies. And so to me, that was always like, okay, well, what are they eating? Let's ask what they're eating, because other things can cause villus atrophy. Other things can cause celiac, right? So in South America, it was corn. And if you start looking into corn, you'll realize there's a gluten in corn called zein. Zein. Now it's not the classic gluten, gliadin found in wheat, or hordein that's found in barley, but it's a gluten in its own right. And so I started digging into the botanical research, and here's what I found. If we define gluten by the botanical definition, and this is T.J. Osborne was the name of the doctor who defined this. So last name's the same, spelt the same, but no relationship. Okay. This is another one of those, I believe God, is intervening in our lives. But T.J. Osborne wrote about, he's also sometimes referred to as the father of plant protein. He wrote about the definition of gluten decades ago, and he said that gluten is the family of proteins found within the seeds of grass that are soluble in alcohol. Like going down that specific, right? And so then he subclassified different glutens into different fractions, omega fractions, etc. So reading his work and then coming across the South American researchers who were finding that zein was just as toxic as wheat gliadin to their patients, And then coming across more work on rice causing enterocolitis and being one of the most common causes of enterocolitis. And then also coming into the research on oats and how oats was never really settled. Like the oats have a gluten in them called avenin. And many celiacs continue to react to oats. And some people will argue it's because they're cross-contaminated with wheat. It's because they're grown in the same fields and they're processed with the same equipment. But I have seen certified gluten-free oats wreck people with gluten sensitivity. And so, I don't buy that argument. And then there's also what we know about the discovery of celiac disease. So if you go back in history and look at the work of William Dickey and Sidney Haas, William Dickey was a Dutch pediatrician who discovered during World War II, he had children in the hospital with celiac disease, and before the early 1950s, you would die. Celiac disease was a terminal diagnosis because we didn't know what caused it, and you would either vomit or diarrhea until you were emaciated and you would die. Right? So it was a disease ultimately that killed you because of the malnutrition, because you couldn't get your gut inflammation under control. But during World War II, grain was rationed and was not available, and these kids started healing. And it was William Dickey's observation, and he wrote his thesis on that observation and published his data. Well, that's when we discovered, okay, we think that gluten causes celiac disease. And the staple grains in Germany aren't corn and rice. They're wheat, barley, and rye. So it was Sidney Haas and Valentine who went on to do some more work. And this is where when you hear about the GAPS diet, which is a later rendition of the earlier work of these other doctors, what is that diet? It's a grain-free diet at its core. And if you look at the people with inflammatory bowel and history of celiac, they don't get better. 5-year studies, and their villus atrophy stays persistent in many cases. So it was that work, and it was my own clinical observation and seeing people going through gluten-free whiplash that led me to find that we got to be true gluten-free. And I term that word true gluten-free, meaning if we look at T.J. Osborne's definition of what gluten actually is, it's the family of proteins found in the seeds of grass that are soluble in alcohol. What are the seeds of grass? Let's look at all the different species of grass. You've got wheat, barley, rye, oats. You've got corn. You've got rice. You've got sorghum. You've got millet. Right? You've got the ancient grains, which many people think, oh, the ancient grains are fine. No, they're not gluten-free. You've got grains that are treated through sourdough processes, and that sourdough fermentation of bread definitely reduces the content of gluten, but it doesn't reduce the content below 20 parts per million, which is the threshold for an immune response. So I think people react less to sourdough bread, but if you're truly gluten sensitive, you shouldn't eat it. Don't go to Europe and eat the bread because they use less glyphosate and think that you're not gluten sensitive if you are, right? So like if you are, the key is if you're gluten sensitive, and that's a genetic predisposition, by the way, it's a lot like mold.
Sure.
People with gluten sensitivity have a genetic predisposition to react to it, and those genes can be measured. But if you have that predisposition, the way to impact and activate those genes to cause inflammation is by exposing yourself to glutens. And glutens are not just wheat, barley, and rye, or the proteins in just those 3 grains. It's the proteins across the spectrum of all grains, the seeds of grass. And so that's, when I say gluten-free, I mean that. I mean grain-free for simplicity's sake, but I thought I'd give you that background so that you'd understand why I came to that, because there's a whole, carnivore crowd, as you're aware of, and then there's a whole, even before carnivore, there was paleo, right? And so what are all these diets have in common is they're grain-free. And that's why I think so many people going carnivore, not all, because many go gluten-free first, but many people going carnivore, they're eating a standard American diet and then they go carnivore and they feel better than they've ever felt in their life.
Right.
And you can't dismiss that, and you can't call them crazy because their experience is theirs. But I think many of them don't have to be that far on that spectrum. I think many of them could come back and eat some plant-based foods, fruits and vegetables and nuts, and be just perfectly fine. But because their experience was hardcore, sad diet to carnivore, they don't want to go back. You know what I mean? Because there's that fear that it has to be carnivore and that there's no middle ground. It's almost dogmatic in a sense for some people. Not all. I'm not trying to insult the community, because I don't ever want to insult somebody's experience of improvement with what they've done with their diet. I think that's demeaning. But it's just my observations clinically that when we see people, I get a lot of carnivores in my office, and they're scared to kind of try to reintroduce some other foods. But many of the carnivores I see have severity of malnutrition. I mean, they've got massive vitamin and mineral deficiencies. And I know a lot of the community says, no, I don't have deficiencies. The carnivore diet provides everything. It really doesn't. And I don't think it's been well enough researched long term. I don't think anybody's been carnivore. I think you have anecdotal stories of, I've been on it for 10 years or I've been on it for 12 years, but I don't think you have any long-term data that shows, we had people going on the macrobiotic diet for decades and then they got sick, right? It took 15 years or 20 years before the problem. So I think that's where we're at right now. I think there's definitely a therapeutic benefit to the diet, but I think we have to approach it with caution and not be dogmatic about it, because it is not a nutritionally complete diet for humans. It just isn't.
So, I mean, I have a few thoughts on that. I wonder if some of the grains, I totally understand what you're saying when there's other plant proteins in it. It is interesting because avidine's also in egg whites. So I wonder if that's part of the.
No, not avidin.
Oh, okay. What was it that you said?
Avenin.
Oh, okay.
Avenin. So
Okay.
avidin, yeah, different proteins,
Okay,
right?
okay. Okay. So but it's interesting because same thing with the egg whites, not that it's the same protein, but because there's a lot of proteins, sometimes people have a hard time digesting egg whites, at least not the egg yolks. But beyond that, all of the grains, seeds, a lot of the things that we just talked about, the way that they're stored, they oftentimes end up breeding mold and mycotoxins. So even just the storage of it is really bad in that way. So I'm totally on the same page with you. I don't think they're ideal human foods. Now, what I was going to say to you about the carnivore community is I don't know. I agree with you that there is a subset that goes from standard American diet all the way to carnivore. They feel tremendous healing. But there is a big subset that they will go keto and they feel some levels of benefit, but not fully. And so they try carnivore. And I just wonder if all the nuances of, like a broccoli versus a seed versus the grains, if people know the nuances and of the breakdown of each product and how it can affect the human microbiome and how you feel. And so if people understood that, maybe there would be a little bit less fear in trying to add more foods. We use carnivore as an elimination diet tool because it sort of eliminates that diet is an issue. So if you are eating just a really clean, strict carnivore diet with nothing added, and your autoimmune is not fully healing, it's probably at that point. Now, nutritionally, there still can be deficiencies for certain situations, but it's probably more environmental related. Maybe there's mold involved, maybe there's some chemicals. I think from the nutrition research I've done, I do think carnivore can be complete, but you have to eat more than beef. So that's where I sort of stand with it. There is an insufficiency of vitamin C, but I think if you are healthy and robust and you're not taking glucose or not eating a lot of sugar, there can be a sufficient level of vitamin C in your system. We do SpectraCell testing too, the micronutrient testing, and we only see imbalances, especially when people are chronically ill. So I think if people are chronically ill, have autoimmune, a steak is not as absorbable as another healthy person eating that same steak, if that makes sense. And then
Oh, yeah.
adding fish, organs, eggs, like if you can eat the rainbow of, land, sea, and sky, then I think you totally can get the nutritional benefits. But the reality is that most carnivores don't eat like that. Most carnivores will just eat the beef and chicken, but you also need pork for the vitamin B1. And we could talk about B1 in a second. But so I totally get what you're saying. I think it's as long as we are strategic and we do the blood work and we document symptomatology, maybe it's okay for our own N=1, but we should be mindful as we are doing a diet that is sort of new. So I'm on the same page with you. I also see people though that fall into carnivore that suffer with the autoimmune and that suffer with chronic illness. So I wonder if it's not really the diet per se, but that people, like as an example, we have seen a connection with a lot of people that suffer from MTHFR are suffering from mold illness and CIRS. So could that be affecting their folate level? So even if they're eating a ton of folate, they're not getting it absorbed. And it's just, it's like, which one is it, the chicken or the egg? But, I wanted to ask your thoughts about mold illness, and you were bringing up yeast. So it's so interesting. We were working with a couple carnivore clients and they still had candida, and they swear that they're not eating any grains or sugary fruits or juice or anything, but their candida is still active 3 years into strict carnivore. And so at that time, I didn't know about mold as much as I know now. And now I know that mold can totally feed off of that. Can you talk about, we have worked with a lot of people that are suffering from small intestinal bacterial overgrowth, but we're finding that they're also suffering from the fungal overgrowth. So SIFO and not just SIBO. There's a lot of yeast in their system. Maybe they're like chronically having UTIs or yeast infections, and then they have the chronic candida. How does that relate to mold? And like you were saying, you said that there's a certain component that can actually act like gluten from yeast, but can you talk a little bit about that and why maybe some people just don't get over their chronic candida and then what they can do?
Yeah, so there's several things to unpack there. One is a this was just published this year in
Okay.
Nature, a research study on the microbiome of people that live urbanly versus people that live rurally. And it's a completely different microbiome. And one of the suspicions that I have is that urban living decimates the microbes that help to digest plant material and to deal with some of the plant protective toxins that can be found in plants. And so people, I think some of the carnivores finding that benefit because of the lifestyles that we're living. And this ties in as well to yeast overgrowth. Many of the things that we're exposed to act as pesticides, which act as microbiomicides. And so, I'm going to give you an example: chlorine and fluoride in the water. Now, some people will filter their water, and that's great. Do that. That's a smart thing to do. But some people don't. They're drinking water that's unfiltered, and you're getting exposure to things that decimate your bacterial microbiome. And when you don't have adequate, healthy bacteria, your gut is a garden. Okay, so think of, the crops that you're trying to grow that are healthy, that are fundamentally good for you to eat versus weeds. There's a battle always between weeds and food, right? Think of yeast as weeds and think of the bacteria, the healthy microbiome bacteria, as the crop in the garden. So if you decimate the crop, then all you have are weeds that have this non-competitive advantage. They have an advantage now because there's no competition for their growth. And so they get all the resources. And so it's not just even the drinking water that poses a microbial threat. It's a lot of the products that we use in our homes, mouthwash, toothpaste. It's a lot of the products that we buy, even if we're on carnivores. I know one of the things, it'd be in an ideal world if everybody could afford, $16 a pound meat, right? Then we could all buy grass-fed, grass-finished, best cuts. But when you're not, you are being exposed to glyphosate because the predominant staple food for animals, for cows as an example, what is it? It's grain, right? Grain stored in silos, contaminated with mold, contaminated with mycotoxins, but also sprayed with herbicides. Now that translates into the animal that you're eating. And if you're eating that animal, it is going to have an effect on your microbiome that could allow for yeast to perpetuate. Then you also have the discovery of something called biofilms. And biofilms are like, if you're a Star Wars fan, think of it as like a protective magical dome that surrounds the cities. It protects it from enemies, missiles, and lasers coming through. And that's what yeast and bacteria, different species, can produce, are these films that protect them from your immune system being able to identify and then subsequently deal with them. And two, biofilm entrenches the microorganism into the layers of the lining of the GI tract. So now they have this community. It's hard to just flush it out. You can do different things with diet change, but ultimately, if it's biofilm protected and if it's antifungal resistant, you run into problems in that regard. So I don't know if I answered all the questions that you asked, but those are some of the big reasons that we see clinically. And so in those cases, we do microbiome testing. If we find candida overgrowth, we do what's called culture sensitivity, Judy, where when we identify the species, we also try to identify what's best at killing it. So like, for example, if this yeast may not be susceptible to caprylic acid, it may be susceptible to berberine or uva ursi or silver or some other type of natural agent or some type of prescriptive antifungal even. But we want to try to get that information the best that we can, because some are resistant. Fungal resistance is, I think, on the WHO's top list of dangers to humanity right now. It's fungal resistance to treatments that humans have evolved and developed. So remember, yeast is a type of fungus,
Right.
so to speak, and they are evolving with us. And I've read some interesting research too, that yeast can tap into our DNA, pull it into themselves, so that our immune systems won't recognize them as foreign, so that they can continue to thrive. And that, I think, is where a lot of it, where we're seeing a lot of it go. I think we're seeing yeast is such a robust and intelligent species of life, that it's learning its way to coincide in our bodies and eat us slowly from within.
Yeah. And I think it's also exacerbated that candida is commensal in us. It's normal to have some amounts, but then it's just when it proliferates. And then when we're taking all these antibiotics, you're having the fungus compete on its own. So you kill all the good and bad bacteria every time we're taking some type of antibiotic or antibacterial, or the antibacterial soap we're using, and then we eat right after, and some of that gets ingested, and then you let the fungus thrive. And so many people don't even believe in mold illness, because they're like, there's mold everywhere. And so it's exacerbating that whole fungal side that you're talking about. I saw that you had a list of, the top 7 things you could do if you do get exposed to mold, or, to beat mold. Do you want to share some of the tips that you have seen in your practice?
The number one thing is to recognize it if it's there. And that's the hardest part of the list of things to do, because it's like you said, there's a disconnect between how dangerous it actually is. Because you got it. One of the things that I think everybody listening should understand is that mold and mycology as a threat is not taught, not one iota, in school.
Oh, I didn't know that.
Graduate school. It is not taught. You get a class possibly on infectious disease, where you learn about some rare kind of third world or tropical species of mold that can cause some diseases, but nobody's teaching that Aspergillus or Penicillium species produce toxins that decimate your health.
Right.
And look, we know this so well because of farming. Like, what's ironic here, when I first endeavored into the realm of mold, I read veterinarian research quite a bit, because if you're talking about protecting the herd, you're talking about preserving the money of the farmer, right? So the farmer is going to do whatever's in the best interest of preserving the herd, preserving the integrity of the animals, so that they don't lose their business, right? So their livelihood depends on it. And if you look at mycotoxins as a threat to animals in farming, it's massive.
Yeah, I've seen
Massive. There's entire industries built around, how do we neutralize mycotoxins in the food? So there are things they use in the feed. They use different binding agents.
Yeah.
They're now patenting new binding agents for the feed. They're patenting new enzymes that degrade and denature mycotoxins in the food. Like, this is all in the farming industry. But doctors don't go to veterinarian school, and, well, at least not medical doctors, right? And so they're not learning this information. I didn't learn it when I went to school. And I took all the same, basic sciences that people don't realize that chiropractors actually, pound for pound, take far more science in graduate school than medical doctors. We take more biochemistry, we take more physiology, we take more pathology, we take more microbiology, we take more nutritional sciences. I mean, pound for pound, I think we're like 50 hours ahead at the end of curriculum. And we never learned it. I never learned about, fungal, environmental fungi or environmental molds becoming problematic. So I think step one is just realizing, get out of your own head and realize that if you're working with a doctor and they told you that mold can't be your problem, run away as fast as you can and find a doctor who's mold literate, because you've got to have the right ally on your team if you suspect it, if there's any inkling at all of suspicion. Number two, it's finding the right people who can do the mold testing in your home. Now there's a lot of ways to identify mold in a human. And there's arguments. I know that you're a CIRS, or at least you've been trained with the CIRS group, and they're a brilliant group. I know that group of doctors, and they've taken this science vastly light years ahead of where it was. So I mean, there's, as you know, there's MSH and there's TGF beta 1 and there's MMP9. These are all markers of inflammation, but none of them are uniquely specific to mold. And there are other things that could cause these elevations. And so that's where I think a lot of with patients, there can be a disconnect of, okay, I know what the doctor's saying, but where's the mold? Show me direct mold evidence, right? And so this is where some newer technologies that have come along, like urinary mycotoxins, I'm a fan of, but I'm not a fan of doing this type of test if a person is drinking coffee and if a person is eating grain and if a person is eating a heavy peanut diet, because those foods contain mycotoxins too, and you don't want to get an artificial positive when you're going through the objective process of trying to help a person understand that mold might be in the background of their home. Because when you ask somebody to move out of their home, you're not asking a small thing. And I know that because I've lost an entire home to mold and almost lost my wife and lost my dog. So we could talk more about that if you'd like, but I know it firsthand. So for me, going through that whole process, I did Shoemaker on myself, mycotoxins on myself. We went through initially 4 different mold inspections. So this is the other part of really trying to identify mold, is finding a mold literate mold inspector, because most of these guys are going to come in, they're going to set up a tripod that's 5 foot in the air, and they're going to run an air test for 5 minutes, maybe do one outside as a control, and they'll do one in a couple of locations in your home. And then they'll proceed to tell you don't have a mold problem because they're idiots.
Right.
Even the WHO, if you look at the WHO's guidelines, I think it's page 93 of the WHO's damp building guideline book that they've put out, says that you can't get a valid air sample without at least performing 27 samples of an airspace. And even then, we learned from Katrina that mold has times of day that it prefers to sporate. Like, so you get like Aspergillus penicillium, they like 4 p.m. They don't like sporating in the morning. I don't know why. They're like people. They have their own schedule, right? And so when you're trying to look in the air, if you've got a mold inspector at your house and it's 9 in the morning and these species are not sporating, and you're relying on stupid air tests to get diagnostic data on your home, you're probably going to miss it. And you definitely will miss Chitomium and you'll miss Stachy, which is black mold, because they're heavy. They don't float in the air. They don't follow the same pathway as mycotoxins, which are airborne. And there's only just become in the last year a way to detect mycotoxins in the air. I don't know if you've seen the new technology there, but I can talk about that too. We have found some amazing things when you combine air testing for mycotoxins with mycotoxin urinary samples along with traditional methodologies, right? And some of those other mold inspector tools. Air tests are good, but wall cavity tests are better.
Right.
Infrared cameras are wonderful because they can detect slow leaks behind the wall. Fiber optic cameras that you can slide behind the wall, because especially if you have the right brightness to the LED light attached to the camera, you can see geometric patterns on the back of sheetrock that others would try to call sheetrock dust. But sheetrock dust doesn't settle in geometric patterns, but mold grows in geometric patterns. And you can actually see these things. I've got thousands of pictures of these on the back of my walls in my home. You should have a mold inspector that knows airflow, that understands the airflow of the house. And there are devices like smoke devices that can be put in your attic and measure airflow. Do your walls breathe air into your living quarters or your living space? So airflow should be measured. Your HVAC should be cracked open. They should be looking at your plenum. They should be measuring the pressures of your HVAC system. Like, all these things matter. So really, if you're going to find mold in your house and you don't have a mold inspector that understands the parameters of those investigation techniques, then all you're getting is a glorified mold inspector who does an air test and gaslights you and tells you you don't have a problem. And this happened to me 4 times. As my dog died, as my wife stopped being able to complete sentences and stayed on the couch all day long. She went from a cross-fitting, human machine to to just a bedridden, unable to complete sentences. Her mind was going into dementia. My son had mysterious rashes all over his body. He was running fevers for weird reasons. My dog had multi-system organ failure, and so we were spending thousands of dollars at the vet trying to figure out what was wrong with her. My German Shepherd, my other dog, so he's 100 pounds, but my little Yorkie was only like 8 pounds. She's the one who died. But my German Shepherd lost like 10 pounds, then 15 pounds. And so you could start feeling the spine on the back of him. And it's just like, we knew we had a problem. We just didn't know enough about the forensics of how to go about doing a mold inspection. And so our builder kept gaslighting us. And so anyway, we ultimately found a forensic mold inspector. And he taught me so much about understanding how to do proper investigation. And I think that's the number one thing. So I know I went a long way to
No, it's
just
good. We love going in detail in this podcast. Go ahead.
yeah. So the number one thing that you can do is get somebody who knows what they're doing in your home to do the right investigation. And don't allow somebody to come in and charge you $1,000 to run a couple of air tests, because that's a total waste of time. And ladies, if you're fighting your husband already on this, because this is what I see clinically, is women who are sick, husbands that maybe the woman doesn't work, the husband's a chronic worker, so he's out of the house 80 hours a week because he's at work. His mold dose exposure is far less than hers. He's also more muscle mass, and he's just more resilient, because men are physically more resilient to mold. This is my experience clinically. So women and children and animals are usually the ones that get sick first. And so, there's sometimes is a battle. The husband's like, I don't know why you're sick. I've spent all this money helping you go to doctors, and I'm not moving out of my house. My house doesn't have mold. I'm not sick. If my house had mold, I would be sick. This is why you need somebody who knows what the hell they're doing, because there's already that psychology within many homes. And so if you lose the husband for the sake of a crummy mold inspector doing an air test, then you may have lost that person's life. You may have just cost that woman her life, because everybody in the house has to be on the same page. That's why you have to be so forensic with it. And so it's just like you're collecting data to be as forensic as you can. So the more data set, the more pieces of the puzzle you can put together through not only the observation clinically of the symptoms of the person, of the patient, but also the biochemical assessment of the patient combined with the forensic evidence collected in the home. Then you can marry all this data together, and now you can sit down and you can say, if you don't leave the house, it's going to kill you. And you can say that with a straight face without losing an ounce of sleep. I mean, I've had patients die in their moldy home because, I haven't had anybody of late had that happen, but backtrack 15 years when I didn't have all this knowledge. Part of clinical practice is you get better as you practice, you get better with more experience. If I could go back in time, I think I could save some people's lives, but we didn't have even some of the testing we didn't have that we have today 15 years ago. And so, you have to look at that as your utmost important responsibility is to collect data to rule it out. Especially because I want to go back to what you said, which is you're absolutely right. A carnivore diet is a beautiful diet when you're just trying to see, is this person's problem their diet, or is this person's problem their environment? Because if you're carnivore and you're struggling, you're in mold. That is 100% true in my experience. Now maybe not 100%. It's 99.9%.
It's pretty close. It's pretty close.
I've seen some cases where gas leaks were making people sick. I've seen some cases where radon was making people sick, but typically mold. And anyway, I'll quit jabbering, but that's number one, is just to find a forensic person, both a doctor and an inspector, that can help you identify that it's even your problem.
Yeah, I agree with you so much. I had a high profile client, and she had tested her home with one of the people you're talking about. And I suspected, because her blood markers were, it was all lit up like a Christmas tree. And yes, it's not specific to mold, but all of those markers combined normally tell a story. And so I just said, look, I know you've already done and money is not an issue for her because she has a lot. And so she then just had her assistant do an ARMY test. So they did some swabs, and it was so high. Her ARMY and HERTS-Me2 score. And then they had an IEP that no CIRS go in, and they had mold everywhere, but they couldn't find it in the air sample. And she thought it was safe. And it wasn't even a money thing, but it was just an inconvenience. Like, no, I already tested for mold. I don't need to. They said it's safe. And so once we just had the assistant run a Swiffer around and collect that dust, and to show that there's fragments and particles of mycotoxins and other biotoxins in the home. And then when they finally got someone that was much more knowledgeable in this space for chronically ill people, mold is not just for when you're trying to sell the house, you just have to prove there's no mold. There is a different level of stringency when somebody is suffering from mold illness. And so you need a person that is much more able to do the due diligence that you talked about. And so finally now she's remediating her home and it's costing a lot of money. But even for her, with the amount of funds she had, she didn't want to do a second layer of testing because she believed that her home was clean because she had the certifications and files and papers and everything from those air sampling testing places. And it was, but she wasn't getting better. She had really bad sinusitis and brain fog. And it was enough for her to finally do more testing. In terms of your healing journey, do you want to share sort of how you figured out why you were getting sick and then what you did now? And do you believe that people can heal from mold illness?
100%. I'll just start with the hope. Yeah, absolutely. Everyone can heal from mold illness. Everyone. And it's my experience that the people that aren't healing aren't out of the mold. And I've seen that happen repetitively where somebody jumps out, the proverbial saying, out of the kettle into the fire. They move and they bounce and they bounce and they bounce and they just keep bouncing in the mold. Look, 50% of the homes estimated in the US are water damaged. So the odds are there's a 50% chance if you just try to move into a new house or a newer apartment or a newer place, why does mold grow? It doesn't grow because you had a roof leak per se, or that you had a busted pipe per se. Now, water, of course, is a prerequisite for mold to sporate and grow in your home. But what people don't realize is it doesn't have to be liquid water. Vapor, right? Humidity above 55% can cause mold. And that was my case. So come back to that. So yes, you can heal. If you're not healing, I know it's a tough pill to swallow. And I had it happen to me. When I moved out of mold, I moved into mold. So I've done it all. I know what happens. And it's not a tough pill, or it's not an easy pill to swallow. And it's not an inexpensive pill to swallow, because I've lost, well, let's just say we're doing a documentary right now. And how much money have I spent on forensics and through this journey? $500,000 easy. Now, I'm just blessed that I've been able to be in that position. I believe God put me in that position on purpose, because one of the things that happened to me before mold is I was tired of seeing people with mold illness. And the reason why is what we've just talked about. It's that psychology of life. It's a hard, it's just, look, I'm up for a challenge and I'm up for hard things, but I'm the kind of doctor too that takes my work home with me. Like, I think about the people that come to me. They're on my minds. They're in my hearts. I want them to get better. And so it's just a tough road. And so I was praying. I said, "Dear Lord, please stop sending me chronic mold cases." And paraphrasing the prayer, but it was like 2 months after that things started coming into my life that we didn't know yet was mold. But the first thing that started to happen to us was just chronicity of fatigue. I'm a 4:30, 5 a.m. guy. I like to get up when the world is still asleep, because I can get a couple hours in of either workout, or I can read and not be bothered and just be in my own head and my own thoughts. That changed. Like, that was one of the first things that I noticed change, where I was struggling to get out of bed at 6 and then struggling to get out of bed at 7. Then for me, I was putting weight on, and I was like, I've always kind of been pretty physically fit. I've been CrossFitting for like 15 years, so I don't mind the work. But now I'm like, I'm growing boobs, what they call man boobs, right? So I'm getting like gynecomastia fat storage around my breast. And I'm like, this has never happened to me before. What's going on? And I'm seeing these little cherry angiomas pop up on my skin, the little red freckles. They look like red freckles, those are signs of estrogen dominance. But fusarium produces zeaxanthin or zearalenone, which is a mold toxin that mimics estrogen. And this is part of what happened to me. We had a lot of fusarium zeaxanthin. Then I start crying at random times. I'm just like a woman. No offense to ladies, but like a woman going through premenstrual symptoms, where you just have huge bouts and swings of emotion. And I'm just like, I find myself driving to work and I'm just bawling in tears. And then that went on for, God, it's hard to remember how long, but several weeks, and it just progressed. And then what started to happen is my shoulder, I couldn't do pull-ups anymore. I didn't injure it. It wasn't like I did something wrong. I didn't train and so, I'd lifted too heavy or something. It was just, why does this hurt now? I'm not getting older. Not really. Like, I don't buy into the whole subscription that age should cause direct deterioration, right? So I didn't injure it, but now I find myself kind of finagling my shoulder and my spine to try to be able to do a pull-up without being in pain. And then from there, my knees start to hurt, and the rest of my joints start to hurt. And now it's like, now I can't even barely work out. And I put on 25 pounds, before it was said and done. And that was over about a 6-month period of time. I'm not able to wake up. My brain, which traditionally I'm gifted that way, my brain works really fast, is now super slow. It's slowing down in a scary way. I mean, it's just happening, right? And so then that was me. Those were some of the main things that happened to me. But then I'm watching my wife, who's having the same kind of physical deterioration. But one of the things that happened, and we look back and we now realize it, but we didn't realize it at the time, because this was right before COVID. So this is not very long ago. We were in Cancun for an anniversary vacation. We came home. This was in 2019, the end of 2019, right before COVID hits the US. We get home. When we were in Cancun, there were a lot of Chinese tourists, and so we thought maybe we got COVID, because when we got home, my wife ran a fever for 3 weeks, like 19 days straight, 102. I mean, just mega fever. We thought this is very odd. And I was down for a week. I mean, but I recovered a little bit quicker than she did. And then I was back to work as usual. So now she's in the house all day and I'm not, right? So now we have this disparity of exposure. But one of the things that happened was when we got back from that trip, my wife's aunt was coming for a visit. And so one of the things that we didn't even realize, but there was like a white dust, Judy, growing on some of our cabinets. And we just thought it was like old construction debris or something. And so she was doing a deeper clean of the house. What she was wiping off was Aspergillus penicillium. This was like the day we got back from Cancun, she's cleaning, and then it was after that day that her fever sets in. So what she was doing was wiping all that mold and mycotoxins off the counters and breathing it all directly in, and it hammered her. We know that today. We didn't know that then. We just thought, again, we thought she had like a severe COVID, because that's what was hitting the news, and it made sense at the time. But from that point on, she never recovered. Like she started out just being tired a lot, and she started gaining weight, but then her mind started going, and it really affected our relationship. So one of the things that would happen would be she would be trying to remember or recall a word, and she'd be mid-sentence and she'd say 5 or 6 things and then stop. And it'd be like a 20, 30-second pause, because she can't get the word. She knows the word, but it won't go from her brain to her tongue. And so I'm trying to fill in the word for her, right, as husbands do. And it's a few times not a big deal, but now most of our conversation is I'm trying to finish most of her sentences. So as this escalates over a period of months, I'm trying to finish most of her sentences. Our communication's poor. She's on the couch most of the day. We don't know why. She's just sick. She stopped working out because she just couldn't keep going. She couldn't muster the energy to do it. And so that's where she's at. And she's got the same kind of migratory joint pain that's happening, where her shoulders are both hurting and her wrists are achy and her muscles hurt all the time. And she's developing kind of a fibromyalgic chronic fatigue, ME, symptomatology. And my son also here, he's super depressed. He's getting weird rashes and they come and go. It's like it's there for 2 days and gone, just all over his torso. He's developing kind of a, he was at the time, he was a senior in high school, and we were, again, we were going through COVID, so everything was locked down, and you were socially isolated. So part of this, it's like you're going through this and you're thinking, is it the social isolationism? Is it, is it all the things and the animosity that's going on in the world? Like, you're just like, one of the hardest things to do as a doctor is to treat your own family and assess your own situation, right? And so here we are in the midst of this, and he's not doing well, and he's having suicidal thoughts. And I didn't know this. They didn't share this with me, but after all this happened, both my son and my wife came to me. She says, in that house, I didn't want to go on.
I'll say something while you're taking a break. Thank you for sharing. It's funny because I shared about chronic inflammatory response syndrome and mold illness, and all of a sudden the carnivore community is like, you talk about nutrition, like why are you going on this random rabbit hole? And I felt like I had Dr. Shoemaker on. I had a few of the CIRS doctors, and I'm like, you know what? I think I'm done too, right? Like we have couples to this day, they fight, and there's conversations about breakups, and they don't believe me, and it just and some of it we felt the well, it's our fault. We introduced this illness to this family, and now they're not getting along, and so I got to a point where I thought, I think I'm done too. Like I've shared about CIRS and mold illness to the world. And so I am not going to share it anymore. It's interesting because I sort of went through the same thing as you. So I decided to get all of my family tested with the HLA genetics and like even a little bit further out. So even cousins and stuff. And we have some of the genetics. I don't think any of us have active mold illness, but now I remember doing because back then I didn't have the website that kind of reads out the genetics for you, but I did it. And I'm like, no, no way. This cannot be real. And I did it again and again. And I remember half crying, half laughing, thinking, okay, I was so ready to let go of this mold illness stuff. And God's like, nope, I need you right here. And I need you to share because some of your people in your family have the genetics and it could turn on one day and you could be suffering from mold illness. And I was like, okay, God, I get it. Like you want me to stand here and share because there's so many people suffering. And you're like, I'm going to make sure you don't go away from it because now it could impact us any day. And so when you shared your story, and I've never actually shared this publicly. So I get it. It is a very hard illness. And it almost is. I've heard every type of comment of, you're just trying to make money off this mold illness, fake disease, right? And it's so not true. It's so not it is not the illness you want to be helping. It is one of the hardest illnesses. And then to say, hey, you may have to rip up your whole house or change houses when you may not even be in a circumstance. I mean, look at the housing market right now, and to share with people and to say there's no guarantee you move into a brand new build that it'll be mold free. And yet that's what you possibly need to get better. It's such a hard sell. And so I was right there with you when you decided you don't want to be part of it. So I totally get it.
Thanks for saving me there. And in our house, we had, upon assessment, they tried to tell us we didn't have a problem. The original mold inspector tried to gaslight us and say, a little bit of mold is okay. And I knew better. At least I think, part of it was I knew better, and I knew that what they were doing wasn't right. But I was trying to give our builder, because our house wasn't even 2 years old, I was trying to give our builder the benefit of the doubt to try to resolve this problem for us. But I didn't realize at the time that it was a conflict of interest for them to hire a mold inspector, because the mold inspector's job was to gaslight us and to tell us we didn't have a problem. And even on air testing, Judy, we had 9,000 spore count of Aspen, 9,000 on air tests. Their solution to that was to come into one room, our master bathroom, to scrub the air for a few days, HEPA vacuum the walls. They claimed they couldn't find the mold. They could measure it in the air, even though air tests suck. So if you find 9,000 on an air test, you have a hell of a problem, right? But when they came back out to say the remediation was complete, the mold inspector came back out. As he turned off the air scrubber, he sets up his air test to take his sample. Yeah, let that sink in. And my wife is like, and she recorded it. She recorded the conversation. She says, I'm a little confused. How are you going to get a valid sample? You just turned off the air scrubber. Of course the air is going to be clean.
Right.
And he gave her some rigmarole about how it's how we do it in the industry. This is industry standard, which it isn't.
Right.
So we lied, and we have it. I mean, we're still in litigation. We're going to, my plan is to make this guy accountable. I don't believe in vengeance, but I do believe that he's putting people's lives in danger.
Sure.
Of course, he got a normal sample there. And it was at that point when that was their solution for my house. That was at that point that I searched and sought out a forensic mold inspector. And so we found a forensic mold inspector. Then we hired an engineering company. Then we hired an independent architect, and we hired and we had deconstruction work done on the house so they could deconstruct some of the walls to see where the problems were. And this is why I spent so much money, because I knew if we didn't figure this out, I was going to lose my family. And we did. We figured it out. And for us, the problem ultimately was what the architects and engineers told us was your house was a death by 1,000 cuts. There wasn't one problem. It was a systemic problem. What happened in our house was the attic, where they're supposed to put proper ridge venting along the surface of the ceiling of the attic. They had about half of the ridge vents and the other half not installed. So there was no proper way for the house to have nice flow of air coming through the attic. And so all that hot air was staying in the attic. And because they didn't put enough insulation, it was then pushing down into the wall cavities. So you had moist air. And I live in Houston, right? So humidity is par for the course. So that humid air, there's no running water. There was no leak per se that caused our problem, but that humid air was pushing down into our wall cavities. And so then the wall cavities behind, obviously, the sheetrock, the paper on the back of sheetrock is perfect mold food, and you've now added moisture to the equation. And the second part of the problem for us was that the house is brick. The weep holes, which are the little holes at the bottom of the base of the windows and the base of the whole house, those are designed because brick is not waterproof. So when it rains, if you ever put a camera behind brick, when it rains, you can see the water coming down because water's emanating through the mortar and then running down behind the wall. That's why when you build a brick home, there has to be at least an 18-inch gap between the framing and the brick. It's so that you don't have just water gushing into your framing, right? So you have that space that's designed to be a barrier, but then you also have the weep holes along the base of the brick so that the water can escape and flow away from the house. Well, when they built our brick, or when they put our brick in, they made fake weep holes. They didn't puncture them all the way through. They were cosmetic only. And to top it off, they threw all the excessive mortar as they were bricking the home. The mortar, they were just throwing it back behind the wall. So the mortar was damming any holes that could have allowed for water or moisture penetrance away from the home. So that was another major flaw. Several of our windows didn't have insulation. Some of them didn't have proper Tyvek wrap. The framing around the whole house, they cut the Tyvek short, like 4 inches. So it was never properly water protected down to the foundation. And there were certain metal pieces that they never put in properly to prevent water accumulation. And the only way we found these things was through this destructive testing. We basically paid thousands of dollars for a company to come out and rip our house apart, right? So that we could forensically identify why it was growing mold. Because our air tests from our wall cavity, some of them were 250,000 spore counts high, black mold, penicillium, aspergillus, so we were basically, and then when they did air testing of our house, they showed that the walls were breathing that moldy air and the mycotoxins directly into our living space. And so at a point, that white that settled on the cabinets, well, our housekeeper, we didn't realize this, but after we investigated, our housekeeper was wiping that stuff off every week. So she quit on us. And I think she quit because she was getting sick when she would clean our house. But we didn't realize that was what was happening because she kept it clean. But now, after not paying anybody to keep it clean, not wiping it, you've got now mold growing, and it's become very visible. The house is still up at this point. We have to tear it down. We're not going to keep it up. But right now it's what we call evidence, because we're awaiting our court date. And so, we have to maintain the home, which is the other, really awful thing about what people have to do when they're in mold. I have been out of my house longer than I lived in it. I'm living next door in a mobile home. And this is not a poor me story. Please don't take it that way. But the psychology of something like that for people, one, you have to leave your home. Two, if you have legal recourse and you want to pursue legal recourse, it is not expedient. It will have been 5 years for us by the time we have our day in court, where we actually get a chance to prove our case. So that's 5 years of being in limbo, possibly, depending. Some people move on and they just take the settlement, whatever the builder offers them. I refuse to settle because um, I just believe in standing firm. I believe in fighting for what's right. And these builders are killing people because my home is not the only home. They cut corners on the Tyvek, they cut corners on the brick, they cut corners on the ridge vents, they cut corners on the insulation, they cut corners on the around the windows. There were so many flaws in the way that they built the home, and this is common industry standard. Like it's to cut corners because what's happened is the housing market has boomed. You have cheap labor and you have unskilled labor.
Right.
And these guys don't know what they're doing. And then you have foremen that are in charge of these workers that don't know what they're doing. They don't know how to properly build a home. And the foreman of the project, these are new college grads. They have no experience in building or engineering. They're glorified schedule keepers. You know, their job is to make sure that the brick is there during this week and that the framing is done during this week and that the HVAC is done during that week. And so they're just keeping schedule, but they don't understand building science. They're not checking on the workmanship or the craftsmanship. And at the time, I thought I knew a lot. At the time when we were building our house, we were like adamant, like we want to make sure it's mold free. We want to make sure this is done and that is done. Boy, what I didn't know, I didn't know anything. I thought I knew a lot more than I did. Now, going through that process, I kind of am a mini construction expert at this point when it comes to mold. I know all the tricks. I hope I know all the tricks. I'm still learning, but the average person shouldn't be expected to understand how to construct a house to prevent mold growth. Like that should be an industry standard. It's just
Right.
like when you go to a doctor, you shouldn't expect, or you should have an expectation the doctor knows what he's doing. Like hopefully he didn't learn anatomy out of a Cracker Jack box, right? I mean, but that's what the building industry is. It's a wild west, and there's no real great regulation. And hiring a building inspector to inspect your home when it's done, or when you're about to buy a home, and those guys don't know anything. And if you read the fine print of the contract, you sign all liability for them away because they're admitting in the contract, I really don't know what I'm doing. It's just in fine print and it's worded like an attorney would word it. And so what you don't really realize is that you just paid $1,000 for a guy to inspect your house who, even if he finds something or doesn't find something, won't be liable for what he did or didn't find. And they're not trained in mold. So anyway, all that to say, it's a mess. The industry's a mess.
Right.
That's part of why we're doing a documentary. We're trying to expose this whole nightmare. And the problem is even worse in the military.
Oh,
I
yeah.
mean, we could talk for hours about the military, but at any rate, that was how we found it. And so I believe God called me to go through it, and he wanted me because he knew that I had the resources to expend to do the forensics, to understand the science, and he's gifted me with the ability of communication so I can communicate what I've learned to the rest of the world so that people are better armed to deal with this, and they're not being gaslighted to just say, hey, sorry, it's not mold. It's you. You're crazy. Here's some SSRIs.
Right.
Here's Paxil, Prozac, or whatever else.
If people are limited in their resources with the home, so let's say their home is pretty not safe. And obviously, it's not just moving into a new home. As you said, your home was new. What are the options, for the average person? Because I don't think the average person has that money that what you all shared and figured out. What can we do that's a possible solution?
If you're within, depends on the state that you're in, get with a mold attorney and understand your rights. Sometimes there's help in that way. Sometimes there's help and there's knowledge and there's direction that allows you to set yourself up to move on with your life while you're waiting for litigation, if you have a litigation case. Now, if your house is 15 years old and there's no litigation, there's no backtracking that far out, you've got to figure out a plan to get out of there, and that is not an easy thing to do. In our case, we owned the property, so we were on acreage, and so we could set up something next door that allowed us to be on the property and stay on the property. But if that would have been a neighborhood house, we would have been forced to relocate. We would have been forced to move out. How do you buy a second house? A lot of people are struggling to afford the one house they have. There's not a simple answer. I know there are a number of people working on solutions. The family that invented OtterBox, they're working on creating temporary housing solutions, affordable housing solutions for people that have been in mold. I was at a meeting not very long ago, and they're still working on it. It's not anything solid yet, but as soon as it's available and ready, I'll make sure everyone knows. But outside of that, I mean, you have to get creative. Family, do you have family that you can stay with? Do you have friends that you can stay with? Do you have the finances to afford something smaller, and even if it's just temporary? If you're on property, is there a way to buy something small? Consider the construction of something like a barn dough, like a barn dominium. If you have the resources to do it, those are potential options. Some people move into tents in their backyard. I've got probably a dozen folks right now in the clinic that are living out of tents and doing better. And I'm, with that's like the most extreme. But if you've got like a family of 6 people and you've got young kids, I mean, how do you live in a tent?
Right.
It's a harder ask. That's the whole thing. That's why at the beginning of this conversation, I was praying for not being involved in this arena anymore, because it's just such a hard thing. But these people need the resources. And I would, if it were me and I had, when we lost our house, it was my adult son and it was my wife and it was my dog. So I didn't have like small infant children. But if it were me and I had small infant children, I would have probably gone and bought an army tent. And I would have set up in the backyard, and I would have put a burner out there, and I would have run electricity out there, and I would have made a makeshift home that would have weathered some storms and would have weathered some changes in weather, etc. If I didn't have the finances, that's exactly what I would have done. Because when we got out of our mold, the first 2 months, once we walked out of that house, because the day that forensic mold inspector came out and found the mold, and he showed me photographic evidence in 5 minutes. He came in, camera behind the wall. He's like, "You have a hell of a problem. You need to get out." Took him 5 minutes to find it. We left that day, and we went first to one hotel, and that hotel had mold in it, and we could smell it. So we got out. We left that one. We went to another one. Nothing detectable. Nothing we could smell. We ended up staying there. It was an extended stay hotel. We stayed there for 2 months because we didn't know what else to do, and we needed the time to organize ourselves and to think about what the next step was going to be. And part of that was finding a good attorney and just knowing what kind of legal rights and legal ground we had to stand on. So we had to understand that before we could make bigger decisions. So that we stayed there for 2 months, but within that 2 month time frame, my wife's brain came back. I mean, she could talk again. She could have a conversation again. I mean, don't get me wrong, we weren't perfect, but that 2 months in that extended stay was very stressful, because you got your dogs are there,
Yeah.
And you're in a 1 bedroom extended stay with your adult son, your wife, and your 2 dogs, and you still have to drive back and forth to work, and you still have to drive back and forth, because I live on a farm and I have farm animals to take care of. So I still got to drive back to my farm and take care of my animals every morning and every night, because animals require caretaking. And so it wasn't easy, but it was a beautiful thing, because you could see the lights coming back on, you could feel the lights coming back on. And so I say there is definitely hope. And for us, the solution was, we knew we were going to be in a long case. And so what we did, we ended up putting a trailer up on the property so that we could still stay on our property and still have a semblance of a home, and weather the storm of patience and data collection, which is what we've been doing the last many years. And so it's another reason why I'm documenting everything, because I want people to know and have a way out. But again, without we have a unique situation. But if I didn't have that same situation, I would definitely have pitched a tent, because I've seen too many people pitch a tent get better. I've seen too many
Same with
people
us.
get in the back of their yards, and they're a month later, they're like a new person. And now, see, the thing about mold, when you're in it, you can't think clearly.
Yeah.
You can't make good decisions. You don't make good decisions. You're too tired to want to cook healthy. You're too tired to want to do the things, like everything becomes overwhelming.
Right.
But when you get outside, all that fatigue starts to lift. Like your mind comes back, and now your brain can think, and now you can make good decisions. Now you can think about your thinking, you can make better decisions, and you can create and craft a plan. But you can never do that when you stay in the mold. And that's where so many people get stuck, is, the brain fog and all that is required to think and to create logistics around the next move can't be possible when your brain is inflamed to the level that it is when you're in a chronic mold situation.
Yeah, that was one of the hardest things that I experienced when I started learning about mold illness and CIRS and these inflammatory markers, all the different biotoxins that can be behind walls in the home, and the VOCs and the endotoxins, and then to explain it to a community that is literally having brain fog and brain imbalances because of this illness is the hardest thing to do. And so we try to get, a lot of the documentation really written out or infographics so that they can talk with their families, assuming that they have the buy-in. But it is really, really difficult. And we have seen people have to, do the tent or build the small home in their backyard, and then they start really seeing healing. And it's hard. That's such a hard life to live, but they finally taste real healing, where maybe a carnivore diet or an autoimmune protocol has not healed them enough, and they're finally starting to feel quote unquote normal, is what they say. And that's when you're like, okay, you get why you're advocating for these people. And when I first started sharing about mold illness, I got so many images of military homes with all this blatant black mold in their face, and they're living there with their families, and there's like nothing I could do. And it's so heartbreaking knowing that. And so I thought, maybe I won't move the needle enough, but if I talk about it enough, maybe eventually the building requirements will change. And so we don't have to advocate for ourselves, and that the infrastructure itself will change, because we are literally poisoning ourselves inside our homes. I know that a lot of the wellness space, especially in mold, believe that you can have a lot of excess mycotoxins or mold growing in your nose, and same with your gut with the fungal overgrowth. But I kind of had a conversation with you, I remember, about that it sort of can grow anywhere. Is that a true fact? And maybe we could talk about it more next time, but just your thoughts on that.
Well, there's some research that's come out recently on mold going into hyphal fragmented forms. It's like think of it like a turtle that tucks into its shell so that it's safe. And then the water pushes the turtle shell down the stream, right? But the turtle's impervious to the rocks and to the predators because it's tucked into its shell. Well, we think mold can do the very same thing and float through people's bloodstreams and then hijack their DNA. And then you kind of almost create a hybridized DNA strain where the immune system won't recognize the mold as an invader. And this is one way we think mold is evolving into becoming more and more of a human problem. When I say mold, I mean like external environmental mold, not candida. I'm talking
Okay.
about, aspergillus. And so like we look at examples of mold infection. Aspergillosis is kind of I won't say it's common, but it's in the realm of knowledge. It's common knowledge that aspergillus can invade the lungs. And that part of how it does that is it produces its mycotoxins that cause DNA, RNA suppression and immunosuppression so that it can take over the host and grow in the host. And then once it colonizes the lungs, it's a 60% mortality rate. That's a strong example of a very, very life-threatening. And I've seen a couple of people die from that when they stayed in their homes. So it's not something I haven't seen happen. And I warned, this is where I try to warn people, but sometimes they just don't want to hear it.
Yeah.
That's mold. Where we're going, we're finding with more and more advanced technology, we're starting to look more at PCR based blood testing, which isn't. I want to be clear about how I say this because I don't want everybody to just go look up PCR mold testing and spend thousands because it's very expensive.
Yeah.
And it's not diagnostic in the sense that just because you have the presence of a mold in a PCR test of your blood does not mean you have an internal blood infection. It's mold is all about evidence. You have to mount enough evidence. And PCR, one of the problems with PCR testing at this point is it's very hard to get good quantification of when you do PCR, it's basically you're making copies of DNA and you're amplifying copies so that you can estimate how much of it is there. But that estimation is very much what's in question. And if you look at what happened during COVID when they were doing PCR diagnostic of COVID, they were finding how much false positive because you can't their amplifications were wrong. And so you were finding the DNA, but it didn't mean you were infected with it. It just meant that there was some presence there. And that's a very different thing than having an infection. So
Okay.
at any rate, that technology is progressing. I think in the next 5 years, we're going to see more and more and more. I think we're also going to see more progression in technology with air testing. There's been one, I told you I'd share it with you. It's the new technology that's come out on mycotoxin testing in the air. So the difference between mold and mycotoxin testing of the air is that mold, generally spores are buoyant and heavy and they fall to the ground, and they will fall down and then out. So when most mold inspectors come in, they put their tripod in the middle of the room, the least likely place they're going to find it. And they don't go to the sides. You got to look at the sides. You got to look in the wall cavities, because mold falls down and out when it hits when it hits the floor. So that technology for mold testing is a little limited in what it can actually tell us. You can't make mold up. So if you do have a positive air test, it is positive.
Right.
But it can hide from your test, and that's part of the problem. But with mycotoxin technology, so mycotoxins work by a different set of physics. They're much smaller. So as mold kind of falls and settles to the ground, mycotoxins stay airborne. This is why a lot of the air quality professionals are now doing what's called they're doing basic fogging, to where they fog the air so that the fog particulate will bind to the toxins floating and pull those toxins to the ground. Because without the fog, those toxins, they work on Brownian motion, which in physics is they just follow a different law of physics. Because they're so light, they just stay airborne. They never really settle. So if you don't do fine particle remediation of a home, this is another reason people get remediation jobs done that fail, is they remove the contaminated material, but they don't properly clean the air, because the mycotoxins and the endotoxins are still circulating, and you have to clean the air. And that's what fine particle remediation helps to do. So a lot of these people did a great job of remediating their homes, but didn't do a great job of remediating the air. And so that's why they're staying sick. Anyway, back up, there's new technology now that you can actually measure for trichotillin and Zea and aspergillus and ochratoxin and gliotoxin in your air, right? So this is brand new. This is something that to my knowledge, it hasn't been commercially available for 2 years. I mean, we're just now seeing, we have some people that we work with that are doing this type of testing, and what we have found is it cooperates extremely well with urinary mycotoxin testing. So which has kind of been an argument scientifically. It's like, well, okay, one, food can be contaminated with mycotoxins, and then two, how do you piece together the fact that these mycotoxins are from these molds? Well, now we can test mycotoxins in the air and mycotoxins in the human, and so now you have kind of more of a direct causal linkage versus indirectly trying to paint an objective picture with multiple types of tests.
Okay. Yeah, I'll have to talk to you more about that offline. I'm interested in that testing. I'm always open to, ways that we can make this easier for the people, because, it is expensive right now. It is really hard, and some people aren't fully healing, and and sometimes we find that they're also suffering from chronic Lyme and chronic Epstein-Barr. But I think a big part of it, the big umbrella, is a lot of times the mold, or being exposed to mold. So it will be interesting to see how much we progress in the science, and get more people to buy in. And I think part of that is legislation needs to change the laws around mold, right? We only think only if you see black mold, then it's harmful. Everything else is not harmful. And that's so not correct. And so I'm so grateful for what you're doing. Share a little bit about your documentary. When is it available? Can people work with you one-on-one? Do you have a clinic practice? If you could share a little bit more where people can find you.
Sure. You can find me online, drpeterosborne.com. There's a tab at the top. If you want a discovery call with our clinic, you can get involved directly, either with myself or with Dr. Driscoll, my associate doc. So we do work with people. Beyond that, if you're interested in more along lines of what we talked about with the True Gluten-Free Diet, glutenfreesociety.org is our foundation. Anybody can go there. I have thousands of hours of free educational information that people can tap into there. So no pressure. Don't just go learn. Learn as much as you can. And then as far as the documentary is concerned, we're probably 46 hours filmed so far. I've got another at least 40 hours probably. This is not going to be a a 90-minute. I mean, we're going to have, it's a docu-series. I am going to have, so to give you the answer, my goal is end of year next year that it should be available, but we're going to be doing two things with it. We're going to be doing a 90 to 120-minute documentary that just simplifies the topic as best as we possibly can so that the person that's not invested in more than 2 hours of a docu-series with 100 hours of footage can just get the gist, right? Can just get the understanding and see it. But the docu-series, we're going deep. I mean, I'm doing a deeper dive, and we're diving into building science, and we're diving into the doctors that treat mold and the methodologies that they're using and the success. And we're diving into stories. We're diving into the military. We're interviewing attorneys that litigate for mold, and so we're interviewing architects who build mold prevention with mold prevention in mind. So it really, the scope of this project got bigger the deeper I got into it, because the more I realized I didn't know as I went. And it's just like, I can't just turn out a documentary that's like wrong. It's not wrong. There's two kinds of lies, right? There's lies of intent, and then there's lies of occlusion, right? And I didn't want to create a product that seemed to be like the end all be all know it all of mold, when we were omitting so much information that people absolutely should know. And maybe not everybody will need all of the stuff that's in the documentary, but if they do, it's there. It's going to be there. So that's coming sometime, hopefully 2025, probably closer to toward the end of the year. And I'll keep you up to speed about the progress of it.
No, I'm excited. I'll have to introduce you to, you might have already been in touch with her, but I'll introduce you to Sharon Kramer if you haven't. So I'll have to talk to you offline.
I'm waiting on her
Okay.
to get back with me for an interview date. She said that she had stuff going on until October.
Okay.
So yes, but yeah, you're
She,
actually who we talked before. If you remember when we were at a conference together,
yeah.
and you brought her name up, and I went and looked her
Okay.
up and reached out to her. So I appreciate that.
Yeah, no, she's on the Hill trying to fight this, all of the, misinformation that they share with the regulations around mold. And she would be she knows like the smallest details of all the laws that have come in. And for her too, she got really sick from a leaked water line in her home, and her and her daughter got super sick too. And I think that's how everyone sort of falls into it. For me, it was, we had a subset of carnivore dieters that weren't getting better. And for me, I got healed with it. And I'm like, either you're not doing it right enough or you're not strict enough, right? It's almost gaslighting unknowingly,
Yeah.
until somebody did a mycotoxin urinary test. And so I said, okay, I got to take this for serious. And I just started doing so much research. Then I ran into CIRS, and so it's been this crazy experience. And then I probably would have left it because, like you said, it's so hard. But when we genetically test a lot of our family members, I'm like, I need to know this even for our own family. And so I do think God is purposely putting us here. I firmly believe it. I mean, in Leviticus, they talk about mildew and then having the priest come. And if the
Yeah.
priest eventually is like, it's not going to work out, he wants you to burn the house down. Like, it's literally in the Bible or Torah or wherever. And so I think it's such an important conversation. So I appreciate all the, you documenting your story, because I know it's such a long and hard, lonely journey for the people that are sick with this. But when they hear a doctor share, like, I've been going through it and I'm actually going through it. The vivid story you shared with me in person was, you get to see your beautiful dream home in front of your face while you're living in the trailer. And that just broke my heart hearing that, because it was infested with mold. And you said you had a book too. Can you share about your book?
Yeah, it's no grain, no pain.
Okay.
And the reason why it's not no gluten, no pain is because of mold and mycotoxins and heavy metals and plant century proteins that are also found in grains. So it's a comprehensive assay on diet change away from all grain, not just from what we classically consider gluten, for many, many reasons. And some of those have to do with topic of today, which was mold and mycotoxins. The highest contamination of food is in grain.
Yeah. Well, thank you so much for your time. And I look forward to seeing your documentary, and I'm sure we'll talk more offline, but thank you.
Yes, you're welcome. Thanks for having me.
Okay, guys, I hope you enjoyed this conversation. There is so much information about how diet can really bring healing, especially when it comes down to autoimmune. If you heard Dr. Osborne's 4 factors, 2 of the factors are related to nutrition, and that is a 4. And so if you eat a meat-based diet, you can have so much healing. And we have seen so much healing in the autoimmune space by just eating a strict carnivore diet. As Dr. Osborne said, maybe as you heal, you can introduce some other foods if you choose to. But I've also seen in our practice where if you eat it long term, that it's absolutely fine too. You just need to make sure and take care of your nutrition, do the annual testing to make sure your health is in good condition. And you should really do that even without a diet. I hope that this conversation gives you a lot to think about. I know that mold is not an easy conversation, but is such an important conversation, especially if you are not well, especially if you are following a strict diet and you're not getting relief from just diet alone. I appreciate Dr. Osborne's share and just his vulnerability. And it is this level of heart and intention that is required for people to heal. So I appreciate his message so much. All right, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.